The reality of mental limitation is a fact of life. An estimated 1 in 4 adults in the U.S. suffer from a diagnosable mental disorder in a given year. These special members of our society still deserve to be loved, dignified, and assisted to live a good life. No matter how mentally challenged your loved ones are, there is a company that offers hope for their development.
Hello, my name is Bob Ochiltree. I am the Program Director for BellTech Enterprises Home and Community Services Program, otherwise known as HCS.
BellTech Home Healthcare Incorporated, 12,000 Richmond Avenue, Suite 130, Houston, Texas 77082.
BellTech has been a leader in providing quality, professional HCS services in Harris County and the surrounding counties since 1995.
We are dedicated to providing a comprehensive community-based service system for persons with developmental disabilities.
Our services are provided in accordance with the principles of normalization to individuals requesting improved independent functioning with respect for the humanity and dignity of each person. We have skilled nursing and professional nursing, ranging from registered nurses to licensed vocational nurses, able, equipped, and have vast experience for a full range of medical, psychological, social, and emotional situations.
My name is Shirley Johnson. I'm the HCS nurse at BellTech. I've been nursing for about 25 years. Specialize in geriatric nursing and totally committed to give 100% to the consumers at BellTech Enterprise. I've taken the vow and the oath to be of assistance to those persons that are less privileged than myself and to be able to be a blessing in their lives.
HCS waiver services available through BellTech include case management, residential assistance, day habilitation, supported employment, nursing, respite, adaptive aids, dental care, minor home modifications, counseling and therapies, audiology, speech pathology, and social work.
I'm one of the case managers here at BellTech Enterprises, and one of my duties is to make assure that our consumers become as independent as possible. We work with their strengths and we try to identify all their needs. We work with the community, we work with the legal guardians to assure that our consumers reach their goals.
For those consumers who, for whatever reason, cannot live in their own home and need supportive home living, BellTech has 7 beautiful care homes. They are each 3 bedrooms and there are 1 consumer to each room. These homes are staffed 24 hours a day, 7 days a week with qualified, experienced, and well-trained home staff members who can provide any service that the consumer needs.
The homes are well-staffed, cleaned, 24-hour staff. The individuals are very well taken care of. The meals are also prepared ahead of time as far as the menus. And so your family members is not only being helped with their medical, dental, all the doctor's appointments, planned meals, activities, but our staff are trained to interact with consumers as well.
We work with DARS to make sure our consumers get involved with supportive employment. We, as case managers, handle all of the consumers' needs. We assure that they have the medical treatment that is required, so we coordinate our services with the nurse. We coordinate services, like I stated before, with the guardians and anyone in the community that will be able to assist our consumers.
I'm Ernest, and I'm a health professional, and I like being compassionate. My job is to take them, pick them from the homes and take them to the day hub, get to their doctor's appointment. Any movement they are doing is my responsibility. Their lives are under my care, and I'm happy doing it because I like being compassionate on people. BellTech is a unique organization. They are very perfect in whatever they're doing in health, and they encourage people to do the best they can to make sure these people are helped and taken care of in all aspects of life, both at home and the day have, even on the road.
Being a nurse is not just a profession, but it is a calling from God. And we are chosen people that make a difference in the lives of those persons that we care for. I'm reminded of one of my clients that was facing a challenge of perhaps being put on hospice care. And I was a part of the decision-making team that made a difference in declining that care at that particular time. This client now is a part of us and has been for almost 1 year. I was caring for her wounds and went from 4 wounds to 2 wounds, and the other 2 are healing up very well. So I really feel grateful that I was a part of the team that made the decision to not put her on hospice, but to take our healing hands and to care for her, giving her a chance to be able to live a few more years in the state that she's in. People talk about her quality of care, but she is who she is, and the quality of care is to be able to give her the things that she needs to sustain her from day to day.
BellTech Home and Community-Based Service is available in the following counties: Brazoria, Chambers, Fort Bend, Galveston, Harris, Liberty, Montgomery, Wharton, Nueces, Beaumont, Port Arthur, Crystal, Waco, Dallas, and Travis. BellTech Home Healthcare Incorporated, 12,000 Richmond Avenue, Suite 130, Houston, Texas, 77082. To reach us, call 281-679-0541 or toll free 1-877-723-2355, or you can fax us at 281-679-0524.